Hi, my name is Katie Imborik, and I'm a clinical professor and physician in the Department of Family and Community Medicine, and I also helped co-found the UI Healthcare LGBTQ clinic in 2012. I'm the current co-director, along with my family physician colleague, Dr. Amy Weiser. I'm so excited to share a little bit about our clinic in anticipation of 1 week for Iowa. Our team is doing amazing work caring for Iowans who are increasingly in need of additional support. The LGBTQ clinic team was the very first in the state to offer a medical home for folks who identify as LGBTQ. In our 14 years since we saw our first patient at Iowa River Landing, we've grown exponentially. Our multidisciplinary team spans 7 departments and has seen over 4,000 unique patients across multiple UI healthcare facilities. In addition to a strong primary care footprint, we have a number of surgeons and specialists who provide expert gender-affirming care procedures and surgeries that are not offered anywhere else in the state. We have truly developed comprehensive health strategies for LGBTQ patients with a focus on transgender and gender diverse folks, those who are most in need of compassionate and expert care. We are so grateful for the LGBTQ Clinic Fund and have had the ability to directly impact patients. The fund has supplied chest binders for transmasculine patients who cannot afford to purchase one themselves. We provide Gender Quest workbooks for every young adult who's considering gender-affirming medications. Additionally, our speech language pathologist has been able to produce instructional videos that can be accessed for free to help transgender patients who are interested in changing their voice to better align with their gender identity. Finally, medical schools, PA schools, and nurse practitioner schools do not routinely provide in-depth education on LGBTQ health topics. If a provider has an interest in caring for this population, it often requires them to seek out additional training opportunities to gain the skill and expertise patients deserve. The Clinic Fund has allowed a number of our providers to do just that. Here's a testimonial from one of our speech language pathologists. I attended the University of Colorado training course on gender-affirming voice. The course was taught by speech language pathologists who are transgender, which provided a more nuanced perspective than my prior training. The workshop included updated information about this service, specific concepts and models, and additional treatment techniques. There were opportunities to network with other SLPs who do similar work to me. I've modified some aspects of my treatment and evaluation, and I've shared some of the perspective and paradigm shifts with the graduate student clinicians I supervise. Thank you for taking the time to hear a little about the University of Iowa Healthcare LGBTQ Clinic. I'm so proud of the team I work with, and I feel so lucky to get to work with queer patients, especially as they are being further marginalized both at the state and federal level. The generous support from donors continues to allow us to do what we do at a level that is unmatched in the state.